Okay, so I'm going to talk a little bit about what's the latest on medicines for obesity and weight loss. And one of the things you can think about for a second is what are the standard treatments for obesity? And of course, we talked a little bit about the first thing you should do before you give up and say I'm going to have surgery is try diet and exercise. So anybody here who has not tried that needs to kind of cancel surgery and give that a shot first? Anyone? Okay. But that's number one, and in some cases it may work. In most scientific studies, people who are 300 pounds that are put on diet and exercise programs have a pretty high failure rate by the end of 1 year. Depending on the research, depending on how carefully they follow patients, roughly 85 to 95% of patients will fail diet and exercise programs by the end of 1 year. So that's not a very successful treatment, although commonly that's what doctors and other healthcare professionals recommend to our patients first. I think the research suggests it's unlikely to be successful in most patients, unfortunately. Another question is, well, what about medicine? And a minute ago we were talking about why don't we invent a medicine that blocks the hunger hormone ghrelin? Take that medicine and go, I'm not hungry. They don't have that yet, but certainly they're trying. Why don't we take a medicine that acts like peptide YY? Take that and go, not only am I not hungry from my anti-ghrelin, but I'm also very satisfied because I have pro-peptide YY. And I can tell you, I'm waiting for that drug. When those come out, I can give this up and just open a pizza parlor. And now that might not work, actually.
What about the fen-phen?
Well, fen-phen worked great. I mean, many of my patients had reported taking fen-phen with tremendous results. They said, I felt wonderful. I wasn't bothered by this drive to eat. I had this kind of feeling of being in control. It was a very enjoyable feeling, and it was very successful. Of course, then they came up with a certain number of people have the heart valve problem, so they pulled that drug. So it's an example where something looked fairly effective, but it had a side effect. And I'm going to tell you that story all over again for another class of drugs. Now, looking at you as an audience this morning, I can tell that you don't know about marijuana. I know you've all had a good upbringing and did not inhale in college or anything like that, so I'm happy about that. But and neither did I. But I did read research that says that when you smoke marijuana, you get something called the munchies.
Yes.
All right. Well, so researchers investigated the brains of mice, and they gave them the active ingredient from marijuana, which is tetrahydrocannabinol. THC, right. And I know you've read research on that. That's why you knew that. And so when they found that, they could put a radioactive label on the THC. They could inject it into the mice. They could find out where in the brain it went. And then they could develop a drug that blocked that receptor in the brain. And when they found a drug that blocked the THC receptor in the brain, it blocked the munchies in the mice, and they lost weight. Not only that, but they also have developed smoking mice. In other words, they've taught mice to smoke.
Are these those French guys?
No, but they're good over there. But so they had smoking mice, and when a smoking mouse got anti-THC, they stopped smoking as well.
Wow.
So the company that invented this drug is actually French. It's Sanofi, Sanofi. And they invented a drug which they called Accompli, which is also called Rimonabant, Accompli. And they did it in very large trials in people, and they found people lost weight. They quit smoking. Their cholesterol went down, and it looked really positive. And they went to get it approved in the United States about 2 or 3 years ago, and it was held up for a couple of reasons that I'll talk about in a minute. But it was approved in England and Europe. So for about 2 or 3 years now, it's been approved in England and Europe, and they just pulled it. It's been withdrawn from the market in England and Europe because of a couple of reasons. One is it did cause weight loss. The average weight loss they were getting per year for a drug that was estimated to cost between $150 and $300 a month was between 15 and 30 pounds. So the weight loss was kind of mild, and they had a pretty significant number of suicides. And if you look in mice, there were some hints of this because the mice did not drop their blood pressure, and although it's hard to measure, they found the mice were a little bit irritable. And when you take away your munchy brain receptor, apparently it bothers us in some cases because you lose some of the, I guess it's one of the pleasure centers. So not only do you eat less and give up smoking, but you don't get rid of your high blood pressure, and it was approved and been pulled off the market because of associated suicides. Now, 3 other drug companies were making Accompli type drugs, Pfizer and a couple of others, and they have stopped all development on their 2 or 3 other drugs because they all seem to have this effect of if you block the marijuana munchie center in the brain, it's not a good thing. So now we can go back to talking about anti-ghrelin and pro-peptide YY. It's possible that in 5 or 10 years they might develop an anti-ghrelin, but it may be that ghrelin has other effects, and one of the effects we know of is it stimulates growth hormone. So it may be that even though we get a drug that's pro-peptide YY or anti-ghrelin, it still may have side effects like the fen-phen. And Accompli is a multi-million-dollar effort where they invested in it, advertised it, to get a drug approved by the FDA. They were very close to getting it approved. And then to pull all that and have to throw it away is a big, big loss after decades of research on that drug. So that's the latest. All of those anti-munchy receptor drugs, and they had 3 of them, and one that was approved for 2 years, have all been dropped because they feel like if you block that receptor, you're likely to lead to other unacceptable side effects. So the area of drug research for obesity looked very bright. Now there are a bunch of others that are kind of in the pipeline which haven't looked as good as this one, so there's still possibilities, and I'm personally optimistic. I think they're going to get it. It's just a matter of time. We've certainly taken on other things where we've been successful, but certainly the Rimonabant or Accompli setback has been one that has really kind of shaken everybody's confidence that we were kind of on the threshold of new medicines that kind of take care of obesity. The other 2 drugs that are available today, just to mention briefly, is sibutramine or Meridia, and a lot of my patients have tried that with, mild weight loss. And then the other drug that's available is called Xenical or Orlistat, which is now available over the counter in a half-size dose called Ally. And that's the one that Miss Judd is advertising. And I'm not sure she's the ideal spokesmodel. It's kind of like choosing Kirstie Alley for, what was she advertising? Nutrisystem. Might not have been the perfect choice for the Nutrisystem to have Kirstie Alley as your spokesmodel, Both of those drugs, if you take them every day for a year, on average you're getting between 5 and 15 pounds of weight loss. On average they were costing around $100+ a month. So for my patients who weigh 300 pounds, to spend $1,000 over 2 years and get 5 to 10 pound weight loss, they're not really powerfully effective. So.